everyone, it's Lauren Ratcliffe again, and I'm here once again to make another video about autism. And in this video is one that you won't hear talked about very often, and it needs to be talked about. It is called Autism and Women's Issues. The introduction here is for most of you all that don't know me. I was diagnosed on the autism spectrum at a time when it was poorly understood. Back when I was diagnosed, it was called pervasive developmental disorder. And when Asperger's was introduced into the criteria, I was given that diagnosis. And back when I was younger, autism of any type was considered to be rare, and especially the high functioning type. And it was not a real common problem, but it mostly affected boys. And when I was younger, it was even more rare to have it in girls. It was almost like it was non-existent. And it was almost like I would have been considered one of the first patients to have ever had autism symptoms as a female. And there's a lot of issues that women face with autism compared to their male counterparts. And I want to share in this video my experiences with women's issues and autism. And when I was growing up in the 80s and 90s, I was taught that women need to be ladylike in certain situations, and that you should not mention private problems like, what would affect your reproductive parts or mental health issues at any time outside of a doctor's visit. I personally believe that there is a time and a place to talk about issues like that, because if you don't talk about issues like that, then there is no way that you can ever get services or accommodations for anything if you need it. Women on the autism spectrum are at higher risk than neurotypical women for problems like rape, abuse from their partners than what a normal woman would be, because of their developmental issues, and of course because of the way women's bodies and minds are in general. The main challenges that women on the autism spectrum have to deal with are their periods, being pregnant for 9 months, and going through menopause. And all of this can worsen sensory issues from autism and autism meltdowns. I have had horrible periods from day one. I was 11 years old when I started my period, and it was extremely painful. And as I got older, my periods grew longer, and they first started out as having 2 periods a month. And as I got towards my mid to late teenage years, they got to be almost 2 weeks long, and it was very frustrating to deal with. And every time that we went on vacation anywhere or took any type of trip, I was always on my period or almost ready to start it. I can remember several times where I've had excruciating meltdowns, and I didn't always realize it was time for my period. I was always pretty good at keeping track of my period, and occasionally I didn't keep track of it. I've always had meltdowns, but right around the time for my period, or like right after it, it was a nightmare for me as far as my moods go. It made everything 10 times worse. So much so that my psychiatrist strongly recommended that I take an extra dose of my antidepressants right around my period time. And at one point, I was having such bad mood swings that my mom even put me on birth control pills to control everything, which honestly, I don't personally feel like they helped me that much. They just gave me a bunch of side effects. And I'm going to say this. I'm going to give you a few incidences where I can remember it was a horrible challenge being on my period. And had I known what I know now, I probably would have even supplemented adult diapers on my heaviest days, or when I couldn't fit a tampon in. One time we were at an amusement park. I was 16 years old and almost 17. And every time that I've ever been to this amusement park, I was on my period or close to starting it. Not so much the other parks. And we had just gotten off a waterlog ride. And my pad would not stay on my underwear. And so my cousin, who happens to be with us, suggested that I wear a tampon. And she went and got me some tampons. And in the midst of all that, when I wanted to be out riding roller coasters, I was near the bathroom waiting for my cousin to go get me a tampon and figuring out what to do, and I was having a meltdown over it. And when she brought me a tampon, it helped. And honestly, I've always had issues with wearing tampons. Another time that I was getting ready to start my period was 2008. I was having trouble sleeping, and I was getting frustrated with it. And I was crying and screaming and tossing and turning. And my mom and my dad were both really frustrated with me. And I couldn't sleep the whole night. Did everything. Took sleep meds. Nothing worked. Was screaming and crying and all that. So, as a punishment, my dad made me get up like 6 o'clock in the morning without my routine that I have before I leave the house. My breakfast, my medicine, washing face, getting a clean outfit on, and brushing my teeth and flossing before doing anything. And so we go to my grandmother's house and we work in the garden picking and plucking beans until like right around noon. I was really frustrated that I had to miss my beauty routine and was still screaming and crying about it, and he was ashamed of my behavior. And then when Mom found out more about it, she was ashamed of it when she got home. And the very next night, I found out I started my period, and that was exactly what was wrong with me. Why the meltdown was way worse. And at the time, I had just gotten off my period. Less than a month before this. And exactly 1 year later, I got diagnosed with endometriosis via a laparoscopic surgery. And we've been on a journey of treatment since then until I had my hysterectomy in 2017. So I'm going to say this. It's important to find a good OB/GYN for women on the spectrum. And a lot of people would not agree with me for this. But it's important to know that you don't have to be sexually active to have any gynecological or bladder issue. And for those women that have these issues, I want to say that I'm very sorry that you have them, because they're very painful and they can impact your quality of life. Even though endometriosis and the bladder disease that I have does not kill, but they're just very painful to live with. I have learned with my own experience about meltdowns. The one way you can predict a potential meltdown is to keep track of your periods and other hormonal issues if you're a woman. And if you are a pregnant woman on the spectrum, please work with your OB/GYN and make sure that your OB/GYN understands autism, because pregnancy, I'm a firm believer, can be an issue with autism. And I feel like more research needs to be done on women with autism in the areas of menstrual fluctuations, pregnancy, and menopause. And for those women that are still single, like myself, and have never been married or had a child, in the Gospels it mentions right before Jesus is taken to the temple to be crucified, that he mentions to his disciples that any woman who has never had a child is blessed, meaning that he does genuinely care about women too and women's issues. So ladies, I'm going to strongly encourage this. Speak up about any concerns that you have about yours or your daughter's meltdowns around your periods, because there is things that can be done about it, and there's nothing to be ashamed of. So, and it's also important to find a provider that will take your health concerns seriously, because your health is vital to your success and happiness. All right. Thank you. Bye.